Welcome back to another episode of What to Expect When Being Placed on Hospice. Now this week I want to go over the disease congestive heart failure, or CHF for short. So this is a chronic illness that most people will live with for 10 to 15 years and will only be placed on hospice for this disease at the very end stage when it's very advanced. Also, this is the disease that people can actually come onto hospice and then go off hospice and then come back on hospice and then go off hospice. It's one of those chronic illnesses that the decline of the disease is not necessarily like this. It can be a little waxing and waning. So when we do see them on hospice, patients with CHF, the symptoms specific to this disease are shortness of breath, usually edema or swelling in the legs and feet, and then pulmonary congestion. So a lot of coughing, wheezing, things like that. So there are so many things we can do to manage those symptoms. We can put someone on oxygen on hospice. They can be on a nebulizer machine to help with the wheezing and the coughing. They can be on cough medicine, steroids. We also use morphine to help with the shortness of breath. All of these things help control those specific congestive heart failure symptoms. And of course, cardiac medications as well, if they need them. They also will be seeing typical end-of-life symptoms that anyone on hospice is likely experiencing. And those are a decrease in appetite and thirst. So they'll be eating and drinking less, usually some weight loss. A definite functional decline. So they were at once, almost fully independent or only needing minimal assistance for like daily living activities. And now on hospice, they're going to be either moderately dependent, meaning most things done for them, or all things done for them. It might even be too hard for them to get up and walk to the bathroom, for example. And then they may have some definitely increased lethargy and then possibly some confusion depending on how well they're oxygenating. So those things are pretty common in all patients on hospice, not just CHF patients. Again, there are so many things we can do to help manage their symptoms. And let me know if you have any questions in the comments and which disease you would like to hear about next. Thanks, guys.